The most common contraceptive is the condom, which is worn by men on their penises to prevent sicknesses, sexually transmissible diseases, but also to prevent pregnancies. Most women who want to be very sure, they also use other forms of contraceptives to prevent pregnancies. And the most common of these are the pills. You have different kinds of pills, and besides the pills, you also have the coil, which you insert in the uterus, and you also have implants that you put in the arm, which releases hormones and prevents a pregnancy. Besides those, you also have the implant. You also have the what they call the pole, which you inject in the muscle, and it is released over a period of 3 months. You also have the rings, the implants, and the coils. You have different kinds of these. Some of them are with hormones, and some of them are without hormones. Most of them are of copper. Some of them are gold plated or platinum plated. Now, these ones don't generally prevent sexually transmissible diseases, and condoms or abstinence is the best bet for that. There is another thing that a woman could use if she's not very sure about the condom bursting or the use of condom by a male. This, for instance, is a rubber that a woman would insert in the vagina. Well, before she inserts it, she needs to cream it with some sort of spermicide-like gel. And then when she's creamed this plastic insert, now you could then, this is a pelvic region of a lady, the buttocks, the back, the anus with the rectum, and part of the large intestines. This is the vagina. Here is the urethra going to the bladder, the pelvic bone, some fat tissues. This is the front part of what you call the vagina. Going up, you have the womb or uterus, fallopian tubes, and an ovary. You have larger vessels there in the inner parts, and this is part of your backbone. Now, if this has been well creamed, you can now insert it in here like this. You insert it through the vagina, squeeze it, inject it in the vagina, insert it in the vagina, and then it would stand in like this. Let me try. There it will be, preventing a pregnancy. So that if this is a penis, you inject the penis in the vagina. Even if when sperm is released, the sperm is stopped from getting through the cervix into the womb. And because of this gel, which has some sort of spermicidal properties, it's not really spermicidal, but it prevents the sperm from running in. You leave this in place for 6 hours after having sex, and then you can then take it out, pull it out. If you want to have more sex 2-3 hours after you've inserted it, you just add some of the gel on it, and then it does the trick. So this is how it would look like. Now, that's the information I'm giving you. Have a good day.